Good morning, everybody. My name is Rita Valenti. I'm a registered nurse. I'm here with the People's CDC to make a report this week on the status of the global pandemic. Particularly, we want to focus in on the global south and the southeastern United States, areas of the world that are often left behind, not discussed, and not addressed in our global pandemic times. Our first slide is the daily new confirmed COVID cases per million folks, and we see no surprises here. The highest rate of cases are on the Northern Hemisphere, Russia, Europe, and Australia, and the lowest rate of cases, confirmed COVID cases, are Africa, India, and Mexico. And we have to ask ourselves, are we gathering all the data that we need? Is this an accurate global picture of the pandemic? The next slide, we're talking about the deaths. And once again, there are some interesting anomalies here. We see that the highest death rates are in the Northern Hemisphere and Russia and Europe. And some of the lowest death rates are in Africa, China, Central and South America. And we have to ask ourselves, knowing about the history and the question of health disparity, why are the death rates so high in the most developed countries? We're talking here about our COVID-19 boosters administered per 100 people. And again, we see some interesting information here. We have very high rates of boosting in Brazil, Argentina, and Chile. Chile with almost 91% of its population vaccinated. Cuba, of course, has a very high vaccination rate, I think approaching about 90%, whereas the United States as a whole is about 66%. This is some screen sharing on the continent of Africa, showing low positivity, and South America the same. This is our test per 1,000 people. I think that the most important thing about this is that since early April, late March, all federal funds for testing, treatment, or vaccination for the uninsured in the United States have essentially been withdrawn. Reported testing is declining in the US at this time, but Chile again has high rates of testing, and there's a lot, Brazil is not showing any information, and there's a lot of data missing also in terms of Africa and China. Hospitalizations, essentially, this is all the United States is doing now to try to track a global pandemic that has huge implications in our communities. This is the weekly new hospitalizations. Most of the world does not either report this data or we have not captured it. The United States with the highest rates of hospitalizations, it's been around 12,000 folks, and Russia and Europe high as well. This is the community levels of all counties in the United States, community transmission levels. And this is the data or the charts that the CDC is currently using now. And in many ways, this is an oxymoron because it really doesn't show community transmission. This is related to hospital admissions and bed occupancy for COVID-19 patients. Again, this is the data prior to the CDC changing its guidelines, recording community transmission levels as high, substantial, moderate, and low. But it's this chart here on population, you can begin to see the differences. If you look at percentage of counties in a moderate or high transmission risk, you're at 39% and 22%. But if you look at it as a percentage of the population, what we're seeing is almost 43% of the US population is in high risk for community transmission. These are the NAT tests, one of the most accurate tests for diagnosing COVID. If, again, focusing in on the global, on the southern US, you'll see very low testing rates and also a patchwork. And that's partly because different states report their numbers at different times and sometimes don't report them at all. Northeast continues to remain high. This is the percent of fully vaccinated population over 12 years of age with the first booster dose of all counties in the US. Here again, looking at the southeastern United States, you're going to see that we have among the lowest rates. Boosting rates in the Southeast are usually, they're under about 40%. Virginia is very low, North Carolina, and throughout the Southeast, very low boosting rates. And we know that boosting is critical to prevent serious illness with the Omicron variants. Just a little bit more on this, because I think it's important, when you see the United States and it says 60% fully vaccinated, that doesn't include boosting. And then when you look at southeastern states, you see rates around 38%, 37%, Mississippi 37%, and down from there. Very low rates of boosting in the southeastern United States. This is the CDC Social Vulnerability Index of all counties in the US, and this just stands out. This area here is the Black Belt of the South. The Black Belt is the historic cotton plantation belt, named such because of its black rich soil. Cotton, of course, and slavery created global capitalism and now suffers from that creation. We see the social vulnerability index that take into account poor housing, poverty, lack of transportation, language barriers, climate crisis events, particularly in the Gulf area, Louisiana, Mississippi, Alabama, and environmental degradation. You take those two things, the social vulnerability aspect and the rate of vaccination, and what you see is a very low rate of vaccination. It would be this box right here, a very low rate of vaccination coupled with a very high rate of social vulnerability. Interestingly, Puerto Rico stands out. It has one of the highest rates of vaccination in the hemisphere. And also a very high rate of the social vulnerability index. So you have to ask yourself, what is it that Puerto Rico is doing differently? What is happening in Puerto Rico, and how can we learn from that? This is the change of new admissions in the last 7 days in the United States. This is a patchwork quilt. It doesn't tell us very much, except the reason why I'm using this slide is because, again, in Puerto Rico, with a very high rate of vaccination, but also with a relatively high rate of admissions for COVID in the last 7 days. There's a lot of questions that we need to try to get answered, particularly if we look at these through the lens of the South and the global South. This is just to be a little more detailed. Prior to the pandemic, of course, pre-pandemic, we already knew that the Southeast and Appalachia, you can see it right here, had on all morbidity and mortality figures, had much higher incidences. These are calculated essentially by asking folks, do you have chronic obstructive pulmonary disease, heart disease, renal disease, diabetes, hypertension, kidney disease, which is much more prevalent in the southeastern United States. And of course, the way the narrative gets switched is to blame the victim, right? To blame the most vulnerable, when in fact, what we're seeing in the Southeast is a total lack of essential public health infrastructure, very high rates of uninsurance. As folks probably know, Medicaid has not been expanded in most southeastern states, and 2/3 of those that fall in the Medicaid gap live in the southeastern United States. And that's Medicaid, which is not the most valuable health insurance. The rates of uninsured it can go upwards of 15 to 20% in these rural Black Belt counties. And then we have the class question on top of our health disparities. We see here, and it's no surprise, that the highest rates of poverty and the highest rates of COVID correspond to each other. And again, this relates to the lack of attention, the lack of public health infrastructure, and really the lack of trust, even when there is some healthcare. It's found that in rural poor counties experience the highest rate of cumulative COVID cases. Most people living in poverty had death rates 1.5 times higher than folks living in counties without that, and death rates 5 times higher than wealthy counties, while during the even more contagious Omicron phase in late 2021. Counties experienced death rates 3 times higher. There's a story that the Poor People's Campaign has shared with us. One woman in Mississippi has lost 20 of her family members through death with COVID. And the last slide is what our vision can be, what our future can actually be. And this is one of my favorite quotes, and I just wanted to share it with you. Historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It is a portal, a gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our average, our data banks and dead ideas, or our dead rivers and smoky skies behind us. Or we can walk through it lightly, with little luggage, ready to imagine another world and ready to fight for it. And we are ready to fight for it. We are ready to walk lightly, and we are ready to look at a vision about what could actually be possible and what kind of health infrastructures we really need, not just for this pandemic, but for the future of all of humanity. Thank you so much.